The Black Death, or the Plague, is a widely studied period in global history. Considered to be one of the worst pandemics ever, the disease killed anywhere between 30 to 60% of the total European population in the 14th century, according to historians. The devastating effects of the Black Death are covered in nearly every history textbook, yet many Americans have never heard of the more recent outbreak in San Francisco during the turn of the 20th century, marking the first ever recorded case of the plague to reach the shores of the U.S.
The first known victim of the plague in San Francisco was a man named Juan King, and he lived in a subterranean basement room where an open sewer line dripped into his room that he shared with two other men. There were bugs and everything else, insects, rodents climbing throughout the room. It smelled pungent. It was enough to make you gag. And it was a place where life was incredibly hard. He lived there for years, essentially staying in the shadows like immigrants and everywhere around the world. He most likely did the jobs that other people wouldn't want to do. They were too hard. So he was working at a lumber yard at the time of his death. And he lived in Chinatown, which really felt like a place dropped from the other side of the world into San Francisco itself.
That's David Randall, author of Black Death at the Golden Gate, The Race to Save America from the Bubonic Plague. The infectious disease, originating from Central Asia, is called by the bacteria Yersinia pestis. It characteristically presents with a bubo, a lump on the body caused by a swollen lymph gland. The first signs show up as flu-like symptoms until the disease progresses to its final stages, where it spreads through the bloodstream, resulting in septic shock and, most likely, death. The bubonic plague is also referred to as the Black Death because the skin of those infected turns black from their dying, bleeding tissue. In 20th century San Francisco, the first plague victim, Juan King, a Chinese immigrant, likely had no idea what he had contracted.
There wasn't much time for him to recognize his diagnosis and seek treatment. He had gone to Chinese traditional healers who couldn't really give much for him. And then his roommates at the time essentially brought his body to a coffin shop because they knew he was close to death. And it was only there that after he died, a public health inspector was just doing a cursory examination of the body to write out a burial permit, and he saw the bubo. And when the public health officer sees this, he jumps back in fear because he knows what it is. And within hours, all of Chinatown is quarantined.
Randall says that Chinatown at the time was filled to the brim, with 20% of the city's population living within a 12-block radius. We know that the bubonic plague is carried by rats and spread to humans through fleas, and this transmission made the temperate coastal city of San Francisco a perfect breeding ground for the disease.
San Francisco at the time really was still kind of a frontier boomtown. It was only 50 years since the gold rush, so there's still gold miners walking the streets of San Francisco. Even as the city grew, the spending on public health declined. So you had this metropolis with the same problems of a festering boomtown, and it was also just incredibly filthy. You could still walk down the street and find the carcass of a dead horse, where people would throw trash and food into the street, knowing that the rats were going to eat them.
Public health workers in the 1900s faced an uphill battle. Randall says anti-immigrant sentiment fed into the spread of misinformation, driving rumors that the plague had become an Asian disease predominantly affecting minorities. The medical community tried to dispel these myths, but was looked down upon and not trusted by the public and government officials.
This was an era where most doctors were still really fighting for legitimacy. People didn't trust the idea of modern medicine or shots and inoculations to prevent diseases. One of the things that city officials started saying, and the governor started saying, was that public health officials who were warning the city of the plague were just in it for the money, essentially, that they were trying to get more funding. And it was a place where they didn't want to admit that anything could ever go wrong. The city officials, the governor, and the editors of the state's largest newspapers all conspire to conceal the truth of the plague.
Randall says the local government at the time was more focused on keeping plague fears at bay, despite its threat to public health. Officials didn't want to raise serious alarm because of its potential effect on the economy, population, and future of the city. With no action, the plague continued to spread until, that is, a federal health officer by the name of Rupert Blue took hold of the situation.
He starts taking these radical steps to, instead of treating it like a racial disease, he starts treating it as a problem of science and sanitation, and he starts making inroads where nobody else ever could before. All these things we take for granted really came from Blue in many ways. So he institutes things like public street sweeping, mandating that trash cans are rat-proof, that public sidewalks are cement and not wood, so rats can't burrow underneath them. And he starts paying people to bring in rats, a quarter or whatever it is. And you soon start seeing teams of kids turn into amateur rat killing squads to make money. So they kill something like 2 million rats, which is 5 times the city's human population.
Randall says in all, the plague in San Francisco is reported to have killed around 200 people. However, that number could be higher because bodies were hidden and many deaths went unreported. Moving forward, San Francisco became an example to other cities across the U.S. who came to adopt the same health, sanitation, and urban planning practices. While nothing along the same lines of the Black Death has occurred in the U.S., the plague is still present today.
About 10 people in the U.S. get plague. Blue, and that's really just a legacy of the fight against plague in San Francisco. They were able to contain it to the human population, but it did spread throughout the western United States and into the rural rodent population.
Mike Antolin, a professor of biology at Colorado State University, studies the modern-day presence of the plague in the Great Plains and its future in the context of climate change.
It is an organism that surprisingly, like for instance in the western U.S., there are 6 to 10 plague cases per year of people being exposed to wildlife and rodents and that sort of thing. And the thing that makes it dangerous is that people forget that it's there. And like I said, if it gets past a certain point, it is still an extremely deadly pathogen.
At roughly the same time as the outbreak in San Francisco, India suffered a deadly bout of the plague from 1900 to 1909, resulting in roughly 6 million deaths. In 2017, Madagascar, an island country off the coast of East Africa, experienced an outbreak totaling more than 2,300 cases and roughly 200 deaths. The plague is now treatable with antibiotics, but if not caught early, it can be fatal. As with any disease, should there be worry over antibiotic-resistant strains?
It really depends on the extent to which it becomes more of a human-associated pathogen. Most of the lack of antibiotic resistance has been because it's a zoonotic pathogen. It's circulating mostly in wild rodents and then spills over into human populations. If you end up with situations where transmission from rodents to humans and then exposed to antibiotics and then transmission back, yes, I can certainly see that would result in antibiotic resistance spreading.
Antolin studies how climate change may impact where the plague pops up.
When it comes to climate change and plague, there are going to be winners and losers, of course. And the question is going to be, who is going to end up in an environment in which you have paradomestic rodents in a relatively wet, not so hot kind of environment living near humans, and that's where the risk will actually occur. I think one of the reasons that we have disease emergence occurring across the planet is because there are just more people around, right? So we're more connected to each other in that sense of to each other and then also to other environments, right? There are people living in a broader number of different kinds of environments where they're being exposed, for instance, to wildlife or that sort of thing. There are more contacts between people locally, and then, of course, there's more long-distance transport.
The public health sector does have the plague on its radar as a potential threat. Hopefully, it stays that way, at bay.
Because it's a reportable disease, the public health sector does take it seriously. So it's an interesting pathogen in the sense of all of the things that it does and the big mysteries that it still carries. In other words, of how does this super deadly thing still manage to stick around?
To find out more about Antolin's research and Randall's new book, Black Death at the Golden Gate, visit viewpointsonline.net. You can also follow us on Instagram and Twitter at Viewpoints Radio, and subscribe and listen to our show anytime on Apple Podcasts, Google Play, and Spotify. Our writer-producer for this segment is Amira Zaveri. I'm Marty Peterson.
Viewpoints returns in just a moment.
How much do you know about migraine? June is National Migraine and Headache Awareness Month, so it's a great time to start learning. You probably know that migraine can be disabling and marked by severe head pain. But did you know that migraine is the third most prevalent illness in the world? In the U.S. alone, millions of people are affected by migraine. And did you know that 1 in 3 patients with migraine avoid planning activities because they fear a migraine attack will force them to cancel? Are you losing precious moments to migraine? What if you could find more moments with less migraine? Ajovy Fremanizumab VFRM injection is a prescription medicine for the preventive treatment of migraine in adults that reduces monthly migraine days, and for some, cuts their migraine days by 50% or more. Ajovy is the only preventive treatment for migraine that can be taken quarterly as 3 225 milligram injections or monthly as 1 225 milligram injection. Do not use if you are allergic to Ajovy or its ingredients. Ajovy may cause allergic reactions such as itching, rash, hives, swelling of face, mouth, tongue, or throat, or trouble breathing hours to 1 month after use. Get medical help right away if you have swelling or trouble breathing. Common side effects of Ajovy include injection site reactions. For more information about Ajovy, including the full prescribing information, talk to your doctor. Call 800-887-8100 or visit ajovy.com.
Family members are typically the first to notice memory issues or cognitive problems in a loved one, but they're often hesitant to say something. A new survey released by the Alzheimer's Association, however, reveals that nearly 9 in 10 Americans would want others to tell them if they themselves were showing signs of memory loss, thinking problems, or other symptoms of cognitive decline. This month, during Alzheimer's and Brain Awareness Month, the Alzheimer's Association and the Ad Council are launching a new campaign urging people to notice the signs and start a conversation. Ruth Drew is Director of Information and Support Services for the Alzheimer's Association.
Alzheimer's disease is challenging, but talking about it doesn't have to be. We say follow the ABCs, assess changes, begin a conversation, and contact the Alzheimer's Association for help.
For information on the campaign and resources to begin this important conversation, visit alz.org/ourstories.
Thank you for listening to Viewpoints Radio, a production of Media Tracks Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Viewpoints stories on Apple Podcasts, Google Play, Spotify, and viewpointsonline.net. Also, follow us on Instagram and Twitter at Viewpoints Radio.